out what's for dinner to taking care of a sick kid, moms juggle a lot every single day. And here with some simple ways to help manage all of that stress is mental health counselor Angela Arias. So welcome to the show. Great to have you here.
Thank you. I'm excited to be here.
Yeah, so we are celebrating moms this Sunday, and there are so many moms at different stages in motherhood. So let's start from the beginning, and maybe a mom that just had a baby, maybe dealing with some postpartum depression. What advice do you have for that mom if they're watching?
Of course. So just know, first of all, that when mom have a baby, there's a transition period, right? So understanding that there is a part and just letting herself feel her feelings and process them. But also being aware that postpartum depression maybe looks very differently from person to person. So they may not all experience the same symptoms.
Yeah, and when do you know that it's maybe time to seek some help?
Of course. So some of the symptoms can be having difficulty getting throughout the day, feeling extreme sadness through most of the day for at least 2 consecutive weeks, not being able to connect with the baby, and also just feeling so hopelessness, feeling like you're not enough. And so if you do have some of the symptoms, it's important that you seek for help.
Yeah, I know a lot of people just call it the baby blues, but sometimes it's more than that. And so you need to be aware of that, the differences.
Correct.
Yeah.
So the baby blues last for the first weeks, right? But if it continues after those 2 consecutive weeks, then it is important to ask for help. So in the crisis center, we do have staff available 24 hours, 7 days a week, where they can call and be connected to those resources in the community, to our hotline, the 211.
211, definitely remember that. And you can call for any reason, any time of day. So when you're up with the baby in the middle of the night and you need someone to talk to, 211.
Correct.
Right? All right, well, let's talk about the moms that have kids maybe in middle school, and it's just craziness right now. I know a lot of people refer to this as Maycember because there's so much going on with the end of the year, planning summer trips. What advice do you have for the mom that's just in the middle of all that chaos right now?
That is totally normal to feel overwhelmed, especially when you have so many things going at you at once, multiple directions at once. So it is totally normal, first of all. And also just remembering that strength does not necessarily mean not struggling, right? Strength can look like asking for help, and that sometimes can be, this is hard and I need some support, and that support can look like going to your doctor, going to your friends, going to your husband as well, and asking for support.
Yeah, and I think there's a lot of power in saying no. Sometimes it's just too much. They want you to bring in cupcakes. They want you to do this. They want you to go to the after party. Maybe it's best if it gets too much to just say no to some of that. Doesn't mean you're a bad mom.
Correct, that it is okay to say no, and that your children will still build core memories.
Yeah, absolutely. Well, what about the older moms that may have kids who are still home, but a little bit older, and they're also dealing with aging parents? I know this, sometimes called the sandwich generation there. What advice do you have for those moms?
That it is okay, like I said, to say no, prioritizing. You can only handle so much, right? So it is about prioritizing and self-care for yourself.
Yeah, absolutely. And I know that, you can't do it all, right? So it's really important to ask for help. And, seeking counseling, if you don't know where to go to seek for counseling, can the Crisis Center help find you a place to go, or at least encourage you to go seek help?
Correct. We do offer counseling, which is free, confidential. We also offer it in Spanish and English, so that can also reduce barriers for the population. And it's just a safe space where they can go, process their feelings, and also kind of look into support from moving forward, especially for the mothers who've had postpartum depression or have a lot of barriers.
Yeah, absolutely. And most importantly, if you get anything out of today, remember that you can always call 211.
Correct.
Right, and there's the website on the screen if you'd like some more information. Thank you so much for being here today. Thanks. All right, Alex.